Hello everyone, today I am going to explain the topic role of genetics in human infertility. Infertility has become a major health issue in today's world, affecting many couples. While people often think infertility is caused only by hormonal or lifestyle factor, genetic plays a very important role. Genes control the formation of sperm and eggs, regulate hormones and guide embryo development. Any genetic abnormality can disturb this process and leads to infertility. Understanding the genetic basis can help doctor diagnose the exact cause and choose the most effective treatment. In this slide, I will explain the infertility. Infertility is defined as the inability of a couple to conceive even after 12 months of regular unprotected sexual intercourse. It affects nearly 10 to 15% of the couples worldwide, making it a significant public health problem. Infertility can be classified into primary infertility, where the woman has never conceived, and secondary infertility, where conception occurred earlier but not again. Causes of infertility include hormonal imbalance, anatomical defect, infection, environmental exposure, lifestyle factor, genetics. Among these genetics causes are the often permanent and require special medical attention. Importance of genetics in reproduction. This slide explains why genetics is essential for reproduction. Human reproduction depends on the accurate transfer of genetic material from parent to child. Genes control the critical process such as gametogenesis, hormone synthesis, fertilization, implantation, and embryo development. If genes do not function properly, these processes fail. Even a small mutation or chromosomal error can result in infertility, miscarriage, or congenital disorder. Therefore, genetic stability is necessary not only for conception but also for producing a healthy offspring. Types of genetic causes of infertility. In this slide, different genetic causes of infertility are explained. Genetic infertility can result from chromosomal abnormalities, single gene mutation, Y chromosome microdeletion, mitochondrial DNA defects, and epigenetic changes. These factors can act independently or together. Some genetic causes affect only male or female, while others affect both partners. Identifying the exact type helps in choosing correct diagnostic test and treatment plan. Chromosomal abnormalities. Chromosome carry genes and any abnormality in number or structure can affect fertility. Chromosomal abnormality interfere with normal gamete formation leading to abnormal sperm or eggs. This results in failed fertilization, implantation failure, recurrent miscarriages. Many infertile individuals may look physically normal but carry chromosomal defect. These abnormalities are commonly detected using karyotyping, which examines chromosome number and structure. Numerical chromosomal abnormalities. In this slide, numerical chromosomal abnormalities are discussed. Numerical abnormalities occur when there is a gain or loss of chromosome known as aneuploidy. A common example is Turner syndrome, that is the 45X in female, where one chromosome is missing, leading to ovarian failure and infertility. Another example is Klinefelter syndrome, 47XXY in male, which causes small testes, low testosterone level, and reduced sperm production. This condition usually results in gonadal failure and requires assisted reproductive technology. Structural chromosomal abnormality. Structural chromosome abnormality includes translocation, inversion, deletion, and duplication. Individuals carrying these abnormalities may appear completely normal. However, during meiosis, abnormal chromosome pairing products unbalanced gametes leading to infertility or repeated pregnancy loss. Structural chromosome defects are a major cause of recurrent miscarriage and unexplained fertility in couples. Single gene mutation. Single gene mutation affects specific genes essentially for reproductive function. For example, mutation in the CFTR gene causes congenital absence of vas deferens in male, resulting in infertility. Mutation in FSHR and LHR gene affects body response to reproductive hormones, leading to impaired spermatogenesis in male and ovulation problem in female. These mutations demonstrate how one defect gene can cause infertility. Y chromosome microdeletion. The Y chromosome contains specific region called AZF, that is azoospermia factor region, which are essential for sperm production. Microdeletion in this region can lead to azoospermia, that is absence of sperm, or oligospermia, that is low sperm count. These deletions are common genetic cause of male infertility. Detection is done using PCR based molecular technique, especially before R procedure like ICSI. Mitochondrial DNA defects. Mitochondria are responsible for energy production in cell. In sperm, mitochondria provides energy for motility, while in oocytes they support maturation and embryo development. Mutation in mitochondrial DNA reduce sperm movement and lower egg quality. Since mitochondrial DNA is inherited maternally, defect can be passed from mother to child, affecting fertility and development outcomes. Genetic causes of male infertility. Genetic factors contribute to 30 to 50% of male infertility cases. These include Y chromosome deletion, chromosome abnormality, and gene mutation affecting spermatogenesis. As a result, may have low sperm count, abnormal sperm shape, or poor motility. This abnormality reduces fertilization ability and often requires art for conception. Genetic cause of female infertility. Genetic abnormalities can affect ovarian development, hormone secretion, and ovulation. Conditions like Turner syndrome and Fragile X premutation cause prematuration ovarian insufficiency, leading to early menopause. These women experience infertility at a young age due to depletion of ovarian follicles and hormonal imbalance. Epigenetic factors. Epigenetics refer to the change in DNA expression without changes in DNA sequence. These changes occur through DNA methylation and histone modification. Environmental factors such as pollution, stress, diet, smoking, aging influence epigenetic pattern. Abnormality epigenetic changes affect gamete quality, embryo development, and implantation, contributing to infertility. Genetic testing in infertility. These slides highlight the importance of genetic testing. Genetic testing helps in identifying genetic defect causing infertility. Tests such as karyotyping, gene mutation analysis, and Y chromosome microdeletion testing guides diagnosis and treatment. Genetic testing is especially important before ART procedure to avoid transmission of genetic disorder to offspring. Genetics and art. Art techniques like IVF and ICSI help overcome fertility, but genetics defect can still be passed to their child. Therefore, pre-implantation genetic testing, that is PGT, is used to screen embryo for genetic abnormalities before implantation. This increases pregnancy success rate and reduces the risk of genetic disease. Genetic counseling. Genetic counseling helps couple understand the genetic condition, inheritance pattern, and reproductive options. It supports informed decision making and helps reduce emotional and psychological stress. Genetic counseling is essential when genetic abnormalities are detected during infertility evaluation. Future advances. Advanced genome sequencing will identify new infertility related gene. Personalized reproductive medicine will allow treatment tailored to individual genetic profile. Gene editing technologies like CRISPR may correct genetic defects. Artificial intelligence and improved PGT will further enhance infertility treatment success. Conclusion. To conclude, genetics play a role in human infertility. Genetic abnormalities affect male and female at various stages of reproduction. Early diagnosis through genetic screening improves treatment outcomes. Integration of genetic with art ensures safer and more successful pregnancy. Advantages in reproductive genetics offer hope for effective, personalized, and ethical infertility management. I hope you like my presentation. Thank you.